I'm Patricia Shella Ayabella, and today I am going to perform a return demonstration in assessing upper extremities. So first, I have to assess the patient to a sitting position. To assess the vascular system in the arms, inspect the patient's hand. They should feel warm and you should not detect edema or lesion. Next, check the capillary refill time by depressing the nail bed until it blanches. Then, quickly release the pressure. The nail bed should regain its normal color in 1 to 2 seconds. Next, palpate the radial and brachial pulses, which should be equal, regular and rate, and rhythm and strong but not bounding in amplitude. Next, continue the assessment by evaluating the arm's sensory function. So, follow these guidelines. Have the patient keep his eyes closed. Scatter the stimuli. Vary the pace. Compare distal and proximal areas. Compare both sides of the body. And map any areas of sensory loss. Sir, please keep your eyes closed. To assess for light touch, randomly touch a cotton waste to the patient's arms and have him tell you when he feels the touch. Feel ka? Na-feel ka? No.
Yes. I feel forever.
Next, to assess the patient's pain sensation, use a broken swab to test sharp and dull sensation. Tell the patient to identify the sensation as a sharp or dull as you lightly touch his skin with the cotton swab. Sir, ina ko if kanang sakit. Ina ko if sharp or dull.
Oh, true.
Sharp or dull?
Sharp.
Next, alternate the sharp and blunt end of the swab. If the patient has trouble identifying this stimuli, assess his temperature sensation in a similar way using test tube. Test tube of warm and cold water. Feel ka? To test the patient's vibration sensation, activate a tuning fork and then quickly place it stem over a distal bony prominence such as finger. But since I don't have a tuning fork, I will just be performing it assuming that I am using a tuning fork. Instruct the patient to say now when the fork starts vibrating. And again, when it stops vibrating, perform this test in both arms. Normally, the patient can tell when the fork starts and stops vibrating. If he can't test his vibration sensation more proximally, you'll also perform his assessment in both legs later in your exam. Next, assess the patient's position sensation. Have the patient close his eyes down as you move one of his finger up and down. Instruct him to tell which direction is moving in. He should be able to do this accurately if he can test his sensation more. Similarly in both arms and later in both legs.
Up, down, up, down, up, down, up, down,
the patient's touch discrimination with the next 4 tests. The first test assessment, diagnosis, asks the patient to close his eyes, then place a coin, key, or other object in his hand, and asks him to identify it. Saan eh?
Money.
Coin? Saan eh?
Coins.
He should be able to do it correctly. The second test assesses graphaphasia. Perform this test if the patient has difficulty moving his hands, trace a number in the palm of his hand, and ask him to identify it. He should be able to identify the number accurately. Isulti kung unsa ang number ha. I-close ang mata.
1, 2, 3. 1, 2, 3.
A third test assessed 2-point discrimination. Randomly touch 2 sharp objects to the patient's fingertips and then gradually decrease the distance between the 2 objects to note the distance at which he can no longer perceive 2 separate points. Normally, this is less than 5 mm. Ina ko pila ka buok. Ipiyong mata. Ina ko pila ni ka buok.
2. 2. 2. 2.
The fourth test assessed extension touch to corresponding parts of the patient's body at the same time and ask him to show you where he was touched. He should be able to feel both touches and identify their location. Now, test. Now, test the motor function by assessing the deep tendon reflexes. For each test, have the patient relax his arm and remember to grade the reflex on scale of 0 if it's absent to 4 if it is hyperactive. Start by testing the bicep reflex. Place your thumb on the patient's bicep tendons and strike it with a reflex hammer. Normally, this causes the forearm to flex. Next, test the tricep reflow. As you support the patient's upper arm, strike the triceps tendon above the elbow. This should elicit forearm extension. Here. Now, test the brachioradialis reflex. Strikes the forearm 2 to 3 cm above the radial styloid process. This normally causes forearm reflection and supination. Finally, you'll assess the cerebellar function of the arm. To assess rapid alternating movement, have the patient pat his knees with his palm facing upward, face then downward. Have him gradually increase the movement. Movements should be coordinated and equal. Okay. Next, ask him to touch his thumb to each finger on the same hand and then touch to reverse the direction. He should be able to do this rapid skilled movement quickly and accurately. Okay. Then, assess the point-to-point localization using the finger-to-finger test. Have the patient touch your finger with his finger and then touch his nose. His movement should be smooth and accurate. Also, perform the finger-to-finger to nose test. Instruct the patient to close his eyes, then have him stretch out his arm and touch his nose with one index finger, then other gradually.